There's a couple of important pediatric emergencies. First off, tummy aches. You know, many times a tummy ache is something very mild and is going to go away on its own. However, when to know when a tummy ache is something serious or not, there's a couple things you can do. First off, if a child will complain of abdominal pain, if you go to kind of squeeze their belly, if they firm up, we call that guarding. They're kind of trying to prevent you from squeezing their belly, and that is a sign of something serious like appendicitis. Also, I call this the jump test. Have the kids, I do this on the phone all the time. Johnny has a tummy ache. Oh, have him jump up and down, and if that makes it hurt a lot worse, could be another sign of appendicitis. So, those two things happen. Easy for parents to do. That's a sign to call your doctor. Next big emergency, burns. About 20% of pediatric emergencies are burns, and most of those are scalding situations. So the key to those is prevention. First, turn your hot water heater down to about 120 degrees. That's still warm enough for your nice, hot, steamy shower, but it's not hot enough to scald you very quickly. Also, be careful with hot liquids. Keep coffee out of reach of kids. Also, get in the kitchen and look up at the stove, all right? That is very tempting to reach up and grab those handles, especially if you see a pot handle hanging off the edge. Always have your pot handles facing inwards. That's super important. And just react. If a child gets burned with a hot liquid, the quickest thing you need to do is get that cooled down. I've been at a restaurant and seen a hot cup of coffee falling. I grabbed the iced tea and literally followed it with dumping that in the child's lap, and it prevented a pretty severe burn.
Wow.
And you actually even put together your own little emergency kit for
Yes.
parents?
Yes, it's so important to have the stuff you need at home if one of these emergencies happen. So I've put together a little kit here. It's got a lot of great stuff in here, some antihistamine. This is a fever and pain reliever, some bandages, scissors.
Having a good pair of scissors.
You gotta have a good pair of scissors.
With any first aid kit.
You gotta have some tweezers for splinters, super important.
Bugs embedded.
Antiseptic wipes and all that good stuff. So there's a lot of great cold packs, for those sprains. You gotta have that.
Wonderful.
I'm actually gonna put this whole list of my emergency kit on our website, thedoctorstv.com, so you guys can go download that list and make your own little doctor's emergency kit.